Now, from the News Channel 5 Network, this is Medical Mondays.
Welcome to Medical Mondays. I'm Jennifer Kraus, and we are glad you are joining us here. We are talking about varicose veins, and joining us for the show this evening is Dr. Tiff Siragusa with Siragusa Vein and Laser, a vascular surgeon. So you have a lot of experience with varicose veins.
Right.
And of course, we're heading into summer. Lots of folks are going to be wearing shorts, bathing suits. They're going to be concerned about how their legs look and, of course, how their legs feel.
Correct.
So why don't we start off, what exactly are varicose veins?
Varicose veins are veins that have become dilated, usually due to an underlying problem with the valves in the larger veins of the leg that you can't see. When those valves fail, the blood flows backwards and puts too much pressure in these smaller veins, and it causes them to inflate and expand like balloons, which typically leads to pain and achiness.
So when are the veins necessarily, bulging out of the leg to have varicose veins, or can they be varicose veins and you just can't see them?
It's a great question. So patients with venous insufficiency, which is a general term for this problem with the valves, they can present with different things. One way that they present is bulging varicose veins that look like ropey snakes in their legs that get worse after working out or being up on their feet all day. Other people will just have swelling. No big veins, no spider veins. They'll just have swelling. Some people get skin changes and are often treated for eczema or different types of dermatological problems. But the skin changes are typically darkening of the skin below the knee on the inner part of the leg, just above the ankle. Some people think it's also from sun exposure. I wear shorts in the summer, and that's just from the sun. It's a tan. But it's more often darker on the inner part of the leg, which would not make sense for the sun.
Right.
And it's not always the same in each leg.
Gotcha. Now, we are going to be taking your calls throughout the show, so please join us, 615-737-PLUS. That's 615-737-7587 if you have questions for Dr. Siragusa about varicose veins. Now, you're talking about how they look. Obviously, people sometimes can be self-conscious if their legs look like this. Should they be treated for cosmetic reasons, or are there other reasons to have varicose veins treated?
That's a great question. Most patients with significant vein disease will have something that you can see on their skin, whether it's the bulging veins, the swollen leg, or the dark skin above the inner part of the ankle. So most people, you can see something. But what brings most people into our office is the way their leg feels. They notice that they'll typically notice the visible changes in their legs, say 10, 15 years ago. And it doesn't really bother them that much. They live with it. They get used to it. But then as the years go by and the circulation gets a little bit worse, well, now that leg starts to get a little bit heavier or ache or tired, or they notice that by the end of the day, especially after working in an occupation where they're sitting or standing for long periods, that their leg's swollen when they get home and they have to lay down and rest and elevate their leg for relief. That's what typically brings people in, is the way it feels.
And what is causing that sensation?
So the veins have one job, and that's to bring blood back up to the heart. After the arteries bring blood down and deliver oxygen and nutrients, all this blood needs to come back up to the heart. When we have dozens of veins in our legs that move blood straight up, and they have valves on the inside. The valves in the veins prevent this blood from moving backwards. When those valves go bad, then you've got backwards flow of blood, of this old blood, through the veins and into its branches, and it doesn't allow new blood to circulate through.
That sounds dangerous.
It's more related to the skin changes you get and swelling and basically the physical impairment that so many people have due to vein disease. The longer it goes on, those skin changes we discussed earlier, the dark skin, that progresses to actual open sores called venous stasis ulcers. And these are also often misdiagnosed as traumatic injuries, and patients end up in wound care and getting treated with antibiotics and all sorts of things, sometimes for years before they actually have a real good vascular evaluation to diagnose it.
Wow. We have a caller already. Again, if you'd like to ask a question, the number to call is 615-737-PLUS. That's 7587. We've got Sam on line 1. Hello, Sam.
Hi there.
Hello.
What is your question?
I'm diabetic, and I know diabetics have problems lots of times, vascular problems. I've noticed that I have a larger, I guess it would be a vein near my ankle, and I just wondered if diabetics have a lot of problems with this.
Good question.
Yeah, that's a great question. Diabetics do have very high incidence of circulation problems. Now, this is a little bit different than vein disease. This is the arterial side that we're talking about. So with diabetics, over time, they tend to develop blockages in the arteries that deliver the blood down to their legs. So they're not getting enough blood to the legs.
Right.
And that can lead to problems like calf pain when they walk because they're not getting enough blood flow. Or even worse, open sores, typically on the toe, or on one of the toes, or on the heel, or on pressure points. Vein disease is no more common in diabetics than in non-diabetics, but it can occur in diabetics as well. And if you have a diabetic patient with any circulation concerns, it's best to do an ultrasound and get it figured out.
So is this something that Sam should go or could go to his regular doctor, or is this something that he needs a specialist for?
Most centers and most doctors' offices or hospitals that do ultrasounds of leg veins are really focused on looking for blood clots. And this problem is due to a problem with the valves. And typically, to get this type of a examination, you need to go to a doctor that specializes in vein disease or vascular surgery.
All right, this may sound like a silly question, but do you only get varicose veins in your legs? Are there varicose veins elsewhere?
You can get varicose veins above the groin line. You can get varicose veins on the abdominal wall. Now, those are usually due to a problem in your abdomen or in your chest where the blood coming through the abdomen is being blocked off, usually by a blood clot. And so the blood is now taking an alternate route, and as it takes these detours, the detours get bigger. So those are veins that you don't want to mess with because they're actually the only way blood's making it back up to your heart. So they're called, you can still call them varicose veins because they're larger veins, but it's not the same problem. It's related to something else.
So as Sam mentioned, he's diabetic, and you said that can sometimes be related, but what else can cause varicose veins?
The most common cause for varicose veins is going to be heredity. So most people with significant varicose veins who have these symptoms we discussed earlier, the swelling, the achiness, the bulging veins, they're going to be spending time at Thanksgiving with somebody else with bad leg veins. It's very common that patients we see, either their mother, sister, aunt, someone that they are closely related to, has also got vein disease. Pregnancy also increases the development of varicose veins. During pregnancy, hormone levels go up that dilate our veins so that we can accommodate for extra blood during pregnancy. And sometimes those veins just stay dilated and stretched out, and a lot of patients develop their varicose veins during or subsequent to pregnancy. Those are the main risk factors. And things that tend to push you a little bit over the edge are going to be occupations where you're sitting or standing for long periods of time. Obesity is related to a higher chance of getting them as well. As the blood's trying to make it back up to the heart, people who are heavier and have more adipose tissue in their abdomen, that's pressure on the veins, so it's making it harder for that blood to make it back up. So that can also predispose.
So if you're predisposed to it, is there anything you can do to try and prevent them, to stay off your feet?
No, not really, because I tell people a lot of people that come in, well, with my job, I'm standing there for 8 hours and I can't do anything about it, and that's okay. There's nothing to do to prevent it. But the good news is that if you do develop vein disease, it's a very easy problem to treat.
And why don't we keep people in suspense as far as how you treat it? We're going to take a quick break. When we come back, we will talk about ways to treat varicose veins. And in the meantime, you can rush to your phone and give us a call at 615-737-PLUS. We'll be right back.
Hi, I'm Kevin Kennedy with the Kennedy Law Firm. You know, a wise man once said that creativity will always give you the upper hand. If you've been injured, call the Kennedy Law Firm and let our creativity go to work for you today.
This week on Fishin' Affliction TV.
Loopy-doo! Oh my gosh!
Join Dan the Man and Miss Vic down in the beautiful Florida Keys for Volume 1 of Fish and Fun.
You know what we're going to call this?
What?
Rockin' and rollin' for Mahi.
Yes.
You did great.
Your Fish and Affliction TV weekend begins Saturdays right here on News Channel 5 Plus, your home for
Fishin' Affliction time for those who've got it bad.
Get relevant, timely health information you can use. Local experts and resources to improve the health of you and your family. Please join me, Amy Marsalis, for Community Health Matters right here on News Channel 5 Plus at 9:30 in the morning on the second Monday of every month. Because here in Middle Tennessee, our community health matters.
Watch Community Health Matters every second Monday at 9:30 a.m. on News Channel 5 Plus. Community Health Matters is sponsored by United Health Foundation.
If your home is unusually dusty and you have black lines around the edge of your carpets, then your home needs Mr. B's Air Duct Cleaning.
We have been tested before, and we know as far as the airborne particulates in a home that we remove the actual 53% of the dust out of a home.
And you can trust Mr. B's. Their technique of air duct cleaning is Middle Tennessee's most thorough.
We want to be absolutely the best at what we do. It's only one way, and that's the right way, and that's the way we do it at Mr. B's Air Duct Cleaning.
Tuesday on Talk of the Town, the inside story on the smash hit Broadway musical Something Rotten from the award-winning Nashville songwriter who created it.
Wayne Kirkpatrick and his brother Kerry wrote the show, and we've got your exclusive backstage pass before opening night at TPAC.
Then, no matter what style you like to read, there are some great new bestsellers to check out. Bookman and Bookwoman break it down for us.
Plus a recipe that tastes like summer.
We're making beef kebabs with pineapple salsa Tuesday at 11 on Talk of the Town.
I have 6 kids. My kitchen can get really stressful.
3 moms sent us an SOS.
Is the bacon crispy enough, Angel? No.
So, Mom of 2 from the Chew, Daphne Oz, is helping them out with a foodie fix human lab.
Your son loved it. That's the only really important thing.
Then 2 tasty desserts, 1 skillet. That's sexy, huh? Plus a sweet 16 birthday dinner. Yay! Next, Rachel.
Tomorrow morning at 9 on News Channel 5.
Hi, I'm Kevin Kennedy, along with my brother Bruce Kennedy, and we're lawyers at the Kennedy Law Firm. You know, we're all the time asked, how do you get those big settlements?
Well, you know, Kevin, the last insurance adjuster I spoke to, he said the Kennedy Law Firm just keeps coming up.
Hello, come in. Y'all call us.
Welcome back to Medical Mondays. I'm Jennifer Krause, joined by Dr. Tiff Siragusa, a vascular surgeon, and we are talking about varicose veins tonight. If you have a question about varicose veins, please give us a call. The number is 615-737-7587. The easy way to remember that is 615-737-PLUS. Now, right before the break, we were talking about what to do if you have varicose veins and treating them. So now I remember this was probably more than 40 years ago. My mom had varicose veins, and it was major surgery. They ripped the veins out of her legs. She had huge bandages, was off her feet for quite some time.
Right.
Things have changed since then, right?
Dramatically. Dramatically. The ideas are the same. The principles are the same, which is someone comes in with vein disease. Start off by getting the diagnosis right. So it takes a quality ultrasound by a registered vascular technologist who's trained in venous disease to find the veins that are causing the problem. And the veins that are causing the problem are the ones with the bad valves that are delivering blood the wrong way. Right. So once you've identified the source of the problem, then you want to get rid of it. And what used to be done was just what you described. We would take the patient to the operating room, make several cuts on their legs, and literally strip the vein out. Rip it out, but they would call it stripping. Right. You couldn't call it vein ripping, no one would sign up. Now, this principle is the same, which is we need to get rid of this faulty vein, and instead of literally removing it, we're able to use the ultrasound to direct a laser fiber into the vein, and once that laser fiber is in the vein, through 3 needle holes, we can numb the entire vein up in about 1 minute, and then once the vein is numb, we turn the laser on, and as we remove the laser, it seals the vein off. So we solved the problem without this big surgery, but the overall end result is the same, which is this vein that's got blood moving the wrong way is now sealed off on itself, so it can't undo the work of the other veins anymore.
And it doesn't sound like it takes as long to do?
No, it doesn't. Usually we're done with this procedure within 6 or 7 minutes.
Really?
The patients are usually in and out of the office in about 45 minutes to an hour, given time to do paperwork and get everything set up and then to get them discharged.
And you said they were awake during this
Patients
procedure?
are awake. Maybe 1 in 5 patients who are a little bit anxious will take a Valium. Just they don't know what to expect, and it helps them relax a little bit. But for the most part, for these procedures, patients are awake. We're talking, making jokes through the procedure, and by the time that we're done, they think we're still just getting started.
Really?
Really.
And what's the recovery time for something like this?
Right. So I ask patients not to do anything strenuous for the rest of the day, but the following day they can resume really any activities that they want to. For the first week or so, they'll have maybe a 2 to 3 level soreness along the course of where this vein was that was sealed off, and it may feel a little bit tight. But just normal activity and a little bit of massaging that area loosens it up within a week.
Now, this vein is used to carry the blood out, but when you seal that vein off, then what, do other veins jump in and take over? What happens?
That's a great question. So as this vein becomes diseased, it actually gets bigger. So you have a vein that starts off normal size and it's doing its job, it's moving blood up. When the valves go bad in that vein, now it starts moving blood backwards. But because the vein is not meant to handle so much pressure, it stretches out and it gets bigger. So now you've got this vein that used to be small, but now it's really big. The problem is it's doing the opposite of what it's supposed to do.
Right.
So you've got all the other veins that are now trying to make up for that. So they're doing their job, bringing blood up, but once that blood gets up to the hip, a lot of it just falls right back down, has to make its way to the good veins, come back up. When we seal this bad vein off, all the other veins continue to do their job, but once that blood gets to the hip, it keeps going to the heart. It doesn't come back down and have to get recirculated out again.
And so how soon do people see...
The same day often.
Results?
Yeah.
Really?
Yeah.
And they feel results?
They feel results the same day or the next day. Sometimes they don't really notice much the first day because they have a compression sock on when they walk out. So they really don't know why their leg feels better. They think maybe it's the compression. But the fact of the matter is that this circulation problem is fixed immediately, and so once it's fixed, then the leg just has normal circulation and their problems are a lot better.
Wow.
Yeah.
We've got Nicole joining us on line 2. Nicole, hello.
Hi, how are you?
Well, thanks. How are you doing?
Doing well. I have a question for the doctor.
Okay.
My mom, she is 76, and she's had varicose veins for quite some time, several years. She's been way less active with the grandchildren and says she can't keep up with them because her legs have been hurting and they feel really achy. Is there anything that can be done for her, for someone her age?
That's a great question. We get this often. With regards to vein disease, the treatments are so minimally invasive. As long as you can lay flat for 15 minutes, we can do the procedure. There's no general anesthesia, which is often one of the biggest risks in doing surgery on the elderly. There are no major incisions, so there's really as close to 0% chance of having a wound problem or an infection as you can get. And the procedures are over very quickly. The pain levels are very, very low afterwards and throughout the procedure, just like I said, 3 or 4 needle sticks. And elderly people recover from this procedure just as well as the younger people. Elderly people actually benefit more from it because usually vein disease is progressive. So someone with vein disease that's causing problems and limiting their activities, that's in their 70s or 80s, they probably already have developed skin changes, they're at risk for ulcerations, and those are the things that can get infected and cause them major problems related to age.
Right.
But the procedure really has no increased problems with advanced age.
And thank you for your call, Nicole. And once you have this procedure done, do they come back? I mean, you've got other veins in your leg. Do they then, are they susceptible to becoming varicose?
They definitely are. And this is a hereditary problem, so it's a genetic weakness in the valves in all of the veins. Now, if you have varicose vein disease and you get it fixed today, 5 years from now, another vein may develop bad valves and cause a similar problem, and you get it addressed. But that chance is not higher by getting it fixed. So regardless of what you do today for your veins, your disease will likely progress either way. The importance is being aware for patients to be aware, for family members to be aware when they see someone with these symptoms of the dark skin around their ankles, swelling, especially if the swelling is more on one side than the other side, or big bulging veins and itchiness on their skin, to be able to identify this as vein disease and get it treated earlier than later.
The number to call, 615-737-PLUS, if you have a question. Do you generally get varicose veins? I mean, if you have it in one leg, is it going to happen in both legs?
Not necessarily. We see some people who are young, who are in their 30s, with 2 or 3 bad veins in each leg and very advanced disease. We see some people who don't have any problems until their 60s, and it's just one vein in one leg. So it's very variable.
Great. We've got now Marilyn joining us on line 2. Hello, Marilyn. What is your question?
Yes, I have a question for my sister. She doesn't live with me. She lives in North Carolina, but she's had for years this large clump of little varicose veins that have accumulated in one big place on the back of one of her legs. And it's just this whole mass of veins, and I've tried to get her to go have something done for that. And it has come up just over probably the course of 15 to 20 years on her. Is there anything that she can have done for that to get rid of it? It looks horrible.
Yeah, there is definitely something that can be done for this. What sounds like she's describing is kind of a bird's nest or a web of spider veins on the back of her sister's leg. And for patients like this, with this much information, it's hard to say exactly how to go about it. But she'd be best off going in to see a vascular surgeon who specializes in vein disease. And if she does have other symptoms that she may not even be recognizing right now, like some other bulging veins, swelling, or skin changes, then that specialist would probably do an ultrasound to make sure her circulation's okay. If the circulation looked good and all the valves are working, usually this is a problem that you can get done with 2 sessions of sclerotherapy, which involves injecting the veins with a medication that seals them off.
And you describe them as spider veins. Are spider veins varicose veins, or are they different and they can become varicose veins?
So spider veins are the smaller veins that become diseased. And they can represent one of 2 things, really. You can have isolated spider veins with no vascular disease, no vein problem, your valves are good. Some people just develop spider veins randomly on their legs, and it's no health concern, it's just a cosmetic issue. But spider veins, especially when you have large areas of them and you have associated bulging veins, they can be the end result of this underlying problem. And that's important to recognize, because a lot of patients that we see have been treated for spider veins, but it was never recognized they had an underlying circulation problem, so their spider veins came back even worse. So it's an important thing to kind of distinguish these patients who have just cosmetic veins from those who have spider veins due to underlying venous insufficiency.
And you described this other procedure with the injection. Is that another way to treat varicose veins, or is that...
This is more a way to address the spider veins, which are going to be the small, thready veins that are typically purple, red, maybe some blue veins that are very thin that you really can't feel. So these are veins that you can more see, but they're flat, as opposed to varicose veins, which typically you can feel them in the skin and see them bulging. But the skin color above the veins is just normal skin.
Gotcha. We will continue to take your calls. We're going to take a break, but come back with us, give us a call, and we will continue our discussion with Dr. Siragusa about varicose veins right after this.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
From News Channel 5, I'm meteorologist Henry Rothenberg with your Storm 5 weather update. Still some showers out there, but they're continuing to diminish in coverage as a cold front will slowly push through eventually as we head into the overnight hours. Otherwise, can't rule out a few light showers, but that should continue to taper off. Here's a look at the temperatures. The rain has kept the numbers on the cooler side, but it's been noticeably humid out there. Ample moisture in the atmosphere. Out at Nashville International, these are the current conditions that we're seeing. The forecast for tonight, we will fall to about 63 as our sky slowly, and I mean slowly, begins to clear. A little bit of fog could develop out there. As that burns off on Tuesday, we start with a mostly cloudy sky. Look for that sky, though, to turn sunny by the end of the day. 82 will be our high, 58 overnight Tuesday, and then below average at 78 and mostly sunny come Wednesday, warming next weekend.
Cancer. With 32 million patients worldwide, it's something nearly every family faces. So it's important to know about research advancements like immuno-oncology, or IO, which aim to help improve survival and quality of life for patients
Like my mom, who beat cancer twice.
and Mrs. Green. Her daughter moved in when she was diagnosed. Like Ryan, his brother has cancer. Immuno-oncology research strives to harness the body's own immune system to help fight cancer.
Join the movement. Ready, Raise, Rise. Visit ReadyRaiseRise.com to raise and share a flag for a loved one, raise money for patient groups, and learn more about IO research.
Welcome back to Medical Monday. I'm Jennifer Krause, joined by Dr. Tiff Siragusa. We are talking about varicose veins, and we welcome your calls. We've got some interesting questions so far. If you've got questions, the number to call is 615-737-PLUS. That's 615-737-7587. Now, how important is it to get them treated? And at what point do you get them treated?
Right. So there's two reasons to get them treated. One is you've got summer coming up. You've noticed each year you're less and less excited about putting shorts on, and you're ready to do something about the way they look. That's one reason. That's a very common reason. The other reason, which is more what we see, is because now your leg, in some way or another, is impairing your ability to do things that you typically would do or enjoy. Commonly exercising, work-related functions such as sitting or standing for prolonged periods of time, and just recreational activities, playing golf, going out with your grandkids or your kids, hiking, things like this, where you notice you're having to adjust your life around your leg. Obvious, more serious reasons to get it treated, which are beyond these that I've described, would be the skin changes, where you start to get thickening of the skin and itchiness, which then progresses to the open sores and open wounds, which is really the end stage of vein disease that you're trying to prevent from getting it treated early.
Is there a target age or a typical age that these tend to develop?
It's most commonly people will start to notice things in their 30s. Oftentimes they're so subtle they really don't seek any treatment for it. Usually by the 40s and 50s is when they start to kind of more notice it as far as the way it feels and also the way it looks.
And you were saying, I think a little earlier during the break perhaps, that it's mostly women that get these?
It is more common in women, although probably maybe a third of our patients are men. Men typically present a little bit later with a lot of medical problems, gallbladder disease, other things. They typically kind of blow things off and put things off until a woman in their life gets them to the doctor. Whereas women are a little bit more in tune with their bodies and what's going on and talk to each other even. So there's a little bit more awareness among women.
And why do more women tend to get these?
A lot of it is the hormonal changes that occur with pregnancy. That's the main factor.
All right.
Yeah.
We've got a couple calls waiting. We've got Frances on line 2. Hold on, Frances. We're going to go to Jane first because she is on line 1. Hello, Jane.
Hi.
Hi.
Wondering if spider veins, do they come back after treated, and what is the typical timeline on that?
Okay. Thank you, Jane.
So spider vein treatment is something that's often misunderstood. If you have a big wedding this weekend, you don't want to get your veins treated today. It's a process. Spider vein treatment typically involves injecting the veins with a medication that causes them to become very inflamed, and during that process they become darker and redder and more prominent. That lasts for about a week. After that week, then you start to plateau off, and after 2 to 3 weeks they start to fade. Now, depending on the size of the spider veins determines how quickly they go away. The smaller, tinier ones go away a little faster. The larger ones take a little bit more time. But in general, if you treat a whole area of spider veins, after about 2 to 3 months, about 80% of those veins should be resolved. Once they're gone, those veins won't come back, but because it's a hereditary problem, the chances of developing new spider veins in other areas are still there, and it then becomes a maintenance issue.
Okay, great. We've got Francis now on line 2. Francis, hello. What is your question?
If you have the spider veins, the large veins in the legs, and then the little black spider veins in the legs, if you get them treated and cleared up, and I say you have discoloration of the skin, will the skin color come back to its normal color?
Ah, that's a good question.
That's a great question. So the skin discoloration typically takes 10, 20, 30 years to develop.
Oh, wow.
With vein disease. It doesn't just turn color overnight. You've got all this blood that's not able to make it out of the skin, basically. And so this blood basically leaks into the skin. The blood cells dissolve, and then the iron and pigment from the blood cells stain the skin. So it's kind of like a self-tattoo of the skin. Now, the body is trying to clean that up, but as long as you have the vein disease and you're depositing all of these pigments, you can't keep up with it. So once you fix the vein disease and you stop this process, your body then has a chance to clean it up. And the skin changes often do reverse and clear up. They may not get as good as the other side is or become normal, depending upon how bad it was, but they definitely do improve after treating the circulation problem.
How important is it to get treated?
It all depends. A lot of it is really, like we discussed, related to how it affects that particular person's life. If you've got no problems with the way your legs feel, you run 8 miles every other day, you work, you're active, you've never noticed your legs other than a few visible spider veins, then it's just up to you if it's important to you for the way they look. But once you start developing these symptoms, without treatment, things typically do progress because each valve that's being tested now, it's like dominoes. The problem just kind of keeps creeping down the leg. Yeah.
Is this a sign of any other problems?
Usually not. Usually varicose vein disease is due to a primary problem with the valves.
Okay.
But things that can look like this could be very dangerous. For instance, patients who come in, or if you develop swelling in one leg, especially if that swelling is pretty rapid in onset. You know, if no problems with my legs, last Tuesday my right leg started swelling up. That could be varicose vein disease if it took longer to develop, but it's more likely a blood clot. So there are other issues that we can talk about regarding vein disease that people need to know about as well, including DVT and blood clots.
Are there other ways to treat varicose veins before you get to the point of the laser surgery with compression socks or other ways of the lesser treatment?
Yeah, and compression socks were a great option for patients when the only way to treat the problem was a big surgery. And then in that case, if you had elderly or otherwise sick patients who wouldn't do well with big surgery, you can put the compression on there and kind of keep things at bay. The problem is the compression socks it's like putting a Band-Aid on. They make the leg feel somewhat better, give patients a little bit more freedom while they're wearing it if they wear it all day, every day. The disease process is still there. It's not really fixing anything. It's like putting your hand over a hole in the wall or something. So compression stockings are good temporizing. Is a good temporizing method, but doesn't really address any problem.
Gotcha. Is this something that insurance tends to cover?
Yes. So this is the most common circulation disorder that there is. And because of that, when it does affect a patient's lifestyle or their ability to work, exercise, or carry out normal activities, then it's recognized by insurance companies and Medicare as a health burden, and it is covered.
And is this something you need to get referred by your primary care physician, or is this something that they could contact someone such as yourself?
Yeah, most patients that we see contact us directly. Unfortunately, oftentimes patients don't have time to bring it up to their doctors, or they don't think it's anything other than cosmetic, so they don't even address it with their primary care doctors. So their primary care doctors may not even be aware they have the problem. So oftentimes we do get referrals, especially for the more severe cases that the patients discuss with their doctors, but oftentimes patients come direct.
Gotcha. The number again, 615-737-PLUS. And you were talking about sometimes people come in and they think they have varicose veins and they don't.
Right. Right. So there are several things that can cause leg problems. We'll just say we see a lot of patients and they really don't know what they have. They think they have a vein problem, which is why they're seeing us, but they really have achiness or pain or shooting pain or numbness, swelling. And so it's our job to figure out what's the cause. And the first thing we do is an ultrasound of their veins if it seems consistent with vein disease. If their ultrasound is normal, then we go down the other avenues to diagnose their problem. Certainly other circulation problems like blood clots or blockages in the arteries are very common causes for patients to complain about their legs. But other things like hip problems, sciatica, even lower back problems can lead to pain in the leg. And we see so many patients with leg disease, and we're pretty good about diagnosing whether it's vein disease or something else.
And obviously you treat the vein disease differently than you would
the arterial.
Right. We've got Kara now on line 1. Again, if you have a question about varicose veins for Dr. Siragusa, the number is 615-737+. Kara, what is your question?
I'm 25 with varicose veins. Thought it was for older people. Is that normal?
Is that normal? It's not uncommon.
Do you have a parent who has varicose veins?
Yes, my mother does.
Your mother does? Yes. So especially with the family history, patients can develop this in their 20s. We've had a few patients actually even younger than 20 that had really large roping veins in their legs. But in the 20s, it's definitely not uncommon. And if you're developing these large bulgy veins at that age, it's good to get it checked out. Compression stockings every day for the next 70 years aren't going to be a good option for Kara. So I would recommend getting an ultrasound and going over the treatment options that would be available to get this fixed.
Yeah. And ballpark, well, if insurance covers it, then there's really not much out of pocket.
That's a whole nother show.
Oh, yes.
Because it all, like, with insurance these days, you can have insurance, but really not really have any coverage because your deductible is $10,000. So for each patient, that we saw 100 patients with the exact same problem. All 100 of them some of them may have to pay nothing, some of them may have to pay all of it. Some of them may pay somewhere in between. But it's all something that's very important for patients, no matter what doctor they're seeing or what problem they have, to call their insurance and find out what their benefits are to get the most accurate idea of what to expect from a payment process for anything medical.
Right, exactly. All right, we're going to take another quick break, and then when we come back, we'll continue to discuss varicose veins and take your calls. We'll be right back.
This is a Talk of the Town Extra.
I'm Tawanda Coleman. Are you ready to lose some weight? April Burton is here with us from Access Weight Loss and Body Balancing to tell us about a new technology that might work for you. Welcome.
Thank you for having me.
April, tell us about your program.
You know what? It's actually not a weight loss program. It's a body balancing program. Your weight can't be in balance unless your body is in balance. And so we use a special technology, and it's the only thing like it here in Tennessee. There's no drugs, no pills, no exercise needed, and you enjoy real food while you're on it.
Oh, wow. So when you say technology, what do you mean by technology?
Great question. We have a revolutionary biotechnology that allows us to scan your body and determine things that are in balance, like hormones, toxins, and minerals. And then we can create a customized program specific to your needs to put you into a significant state of fat loss and body balance.
Well, you know about this program all too well. Tell us about your experience.
I do. I've done 3 rounds of it, and I've lost nearly 90 pounds.
Wow.
It was so easy. I wasn't hungry, and the weight just fell off. I'm so grateful.
We're seeing a picture of you before and after. It's amazing.
Thank you.
So I understand you have a special offer for us today.
We do. Normally, we have a consult and body composition analysis that's $100. But today, for the first 20 callers, we are offering it for only $25. You can go to accessweightloss.com and watch our video, or you can call us today at 615-656-8383.
Fantastic. As she just said, for more information, Access Weight Loss, just visit their website at accessweightloss.com or call the number you see on the screen. Thank you, April.
Thank you.
3 TV shows about the White House.
Scandal? This is the worst.
Ellen squares off with Kerry Washington.
3 greetings you use when you can't remember someone's name.
Look at you! Hey, man!
The Backstreet Boys compete with their feet. And
here's my daughter and her grapefruits.
Winning baby picks.
They grow up so fast.
Tomorrow at 3 on News Channel 5. Inside Politics on News Channel 5 Plus. A show where decision makers from Nashville,
we're moving very aggressively on this. I don't think this is something that we can wait on.
all the way to our nation's capital, aren't afraid to speak up.
Could have been chaos in the House of Representatives.
Each week, host Pat Nolan sits down for exclusive interviews with some of the most influential players in politics.
That may be the issue.
Inside Politics, Friday nights at 7 on News Channel 5 Plus, and at these encore times.
All right, welcome back. We are coming in the last few minutes of your opportunity to call in. So if you have a question about varicose veins, now is the time to make that call. 615-737-7587. We are talking about varicose veins with Dr. Tiff Siragusa. You have offices, couple offices around town.
2 offices. One in Nashville on White Bridge Road by Target. Another one in Hermitage right by Summit Medical Center.
Okay, and you've been in town for quite a while.
9 years. Yes, we started out with 1 office about 9 years ago, and 3 years ago opened up our 2nd office, and have really been embraced by the community and do a lot to educate patients and educate the community on vein disease. Awareness, like we talked about, is a huge factor. We see so many patients with the advanced disease, with the wounds and the ulcers, that really never knew what was causing their problem. So they just they spend so much time putting medicine on it and wrapping their legs and never getting it addressed. So we do a lot to get the word out on not only that, but on what you brought up earlier with regards to your mom's treatment. That vein treatment today is nothing like it was even 15 years ago.
Right.
Yeah.
Where do you see things going as far as treating?
I think things have come pretty far as the minimally invasive aspect of it.
And you say it's just 3 small needle?
It's all done through needle holes, yes.
And just 3? And
3 needle holes to numb that entire vein up.
Right.
And 1 needle hole where we actually insert the laser. Yeah, and the fiber of the laser is smaller than a cocktail straw, so these little pinpricks and IVs that we start to get the laser in are very small.
So, I mean, you just cover it up with a Band-Aid when you're done, essentially?
It doesn't even need a Band-Aid.
Really?
Yeah.
And patients don't feel it? They
feel the needle sticks, just like whenever you have any other minor procedure done where you get an injection of numbing medicine that numbs you up. You feel the needle stick, and then the area goes numb. But consistently, we're told it's not as bad as the dentist.
And you said you're seeing more patients, and you attribute it not so much that there are more people with varicose veins, but more people are aware of it or interested in getting it fixed?
Yeah, I think more people are understanding the disease process and understanding the fact that the treatments are not like they used to be, that they're very safe, very effective, and very minimally invasive. And patients are talking to each other with social media and everything online now. There's a lot more interaction of people regarding everything. So people are discussing different health problems with each other online. People are letting each other know, oh, I had this problem and this is what they did for me. It wasn't that bad of a procedure, and this is who you should go see. So I think the awareness is much improved.
When you talk about maintenance for people who have it continuing to come back, how often do they need to come back for these treatments?
It all depends. After we get the current problem under control and get everything treated, we have a long talk with the patients about what to look for. And so at that point, you're on your own. They're your legs. You see them every day. You'll know before anybody else knows if something starts to creep up, and then you know that's your trigger to go get it checked out and make sure everything's okay. We do follow-up for the first year after your treatment to make sure everything that we did stays closed, every vein that we treated stays closed, and there were no new problems in that first year. But after that, it's up to you.
And Just, we've all probably seen people who have varicose veins, and it is kind of gnarly, and you can see, you know, a variety of veins on the leg and foot. Is that generally caused by one vein that you have to treat, or when you go into a leg, is it more than one vein that you have to treat?
Most often it's one vein. It's one vein that's you can think of as a northbound delivery system of blood, but that vein accepts blood from a lot of branches.
Okay.
So as the blood comes backwards down the one that's not working properly, it escapes out into the ones that you can see. So it's usually two things going on. It's the varicose veins that are visible on the leg that get your attention.
Right.
But then what we do with the ultrasound is we trace those back to their source. So the treatment of this is really twofold. One is treat the source of the problem by sealing that vein off, and then the second part is if there's anything left to do as far as spider veins or small varicose veins, address those afterwards.
So you could do both in the same procedure?
Sometimes. It all depends how many veins you have, because this is all done with local anesthesia. And so you want to stay within that safe limit of lidocaine in this case,
right,
as far as how much you want to give per setting.
Right, right. And interesting. And people will see a difference
the next day when they take their stocking off.
Amazing. Describe some of the reactions you get from people.
Hugs. A lot of hugs, which is great. I'm Italian, I like to hug, so it's great. A lot of smiles, a lot of hugs, a lot of, I can't believe for that 10-minute procedure it made this much of a difference. Yeah.
That's amazing. How did you get into this?
I was initially interested in general surgery, and during my general surgery training I really had a knack for vascular surgery. And as the years of general surgery training went on, I liked it even more and more and decided to specialize in it. So I did another 2-year fellowship just in vascular surgery before starting my practice.
And varicose veins, just...
Varicose veins and all the circulation problems, right.
Right,
yeah.
right. What other kinds of problems do you end up treating?
So we often treat carotid artery blockages, which is a blockage in the neck artery that can cause a stroke. We treat abdominal aortic aneurysms, which is when the aorta in the abdomen stretches out and can pop if it gets to a certain size.
Right.
And with regards to the legs, we also treat a lot of peripheral arterial disease, which is the blockages we talked about with Sam earlier.
Right, right. And that can be confused.
Right.
For varicose veins. So sometimes people come in and to see you.
They think they have fleas and they have ticks.
And both are problems, but both
we know
you can
how to
take
treat them
care
both.
of. Exactly, exactly. So you have offices both in Nashville, the Nashville area. If they would like to contact you, they can email you with an appointment request to medicalmondays@ouradvancedhealth.com.
That's right.
You also have an advanced health referral line, 615-986-6033.
That's correct.
615-986-6033. If you would like to call, if you feel you have varicose veins, if you'd like them evaluated, you can do the ultrasound, check them out, and determine, you know, if they are in fact varicose veins and what would be the best way to treat them.
That's right.
What do people do when they start to have these problems when they put it off? I mean, do they take an aspirin and think it'll go away?
A lot of times patients will just go home and instead of doing what they would normally do, either go out to eat or do something with their kids, they go to the couch and put their legs up. Sometimes they'll get some advice about compression stockings to help with that. A lot of patients lose sleep over it. This is a very common cause of restless leg syndrome. So for patients who are up at night and have to get up out of bed and walk around, this is also a very common cause for that.
And how does it cause it? And what exactly is restless leg syndrome?
So restless leg syndrome is when it occurs most often at night, and it describes a state where you can't really get your legs to relax. They don't really hurt, but they're just restless. They're moving uncontrollably, and they feel a little bit heavy, a little bit achy, and getting up and walking around a little bit makes them feel somewhat better. And what happens at night with vein disease, because blood in these veins should be moving up, while you're walking around all day, you're just having all this old blood pool up in your leg. So by the end of the day, you've got all this old blood pooling up in your muscles, to where at night the chemicals are imbalanced in your legs. You have a little extra lactic acid and potassium, and so the muscles react to that. once the vein disease is fixed, you have normal circulation. So by the end of the day, you don't have the accumulation of all these products, and the leg feels better. We had a patient whose husband was very worried the second night that he woke her up a few nights in a row because he was so used to her waking up 4 or 5 times a night. He thought something was wrong with her. But she was just finally sleeping.
And so was he.
And so was he.
Or he could,
he wasn't used to it.
potentially.
It took him a bit, but he got used to it.
Now, I know that for pregnant women, they recommend that you eat a banana before you go to bed. That has nothing to do with this?
I like bananas. Bananas are great. Pregnancy does bring on vein disease, and for patients who develop bulging veins during pregnancy, I would advise to wear compression stockings throughout pregnancy, because also you're at a higher risk of developing phlebitis, which is small clots in those veins, which can be very painful and very annoying if it does develop.
If you develop varicose veins during pregnancy, what's the likelihood that they will shrink or that you will have to eventually have them treated?
Yeah, more than half of patients who develop varicose veins for the first time during a pregnancy, more than half of them, most of that disease will get better once they're done breastfeeding for a couple months and their hormone levels re-equilibrate.
Okay, but then if they have this genetic predisposition,
then they're more likely that it'll persist.
And there were some other risk factors again also.
Yeah, in addition to the heredity and the pregnancies, obesity, standing for long periods of time, those are the big ones.
Great, great. All right. What would you leave folks with? What would you want people to know about varicose veins?
Well, circulation problems in general can be a matter of life or limb. So until you get it figured out, it's really something that you shouldn't just brush under the rug. If you've got any problems as far as achiness or pain in your legs, especially if it's interfering with your ability to do things you normally do, it's something you should probably get checked out.
And it's easy.
The tests are all very easy. They're office-based tests, which are usually ultrasounds, so they're non-invasive, and they take 15 to 20 minutes to do.
And how quickly do you get the results?
The same day. Yeah, so we do the ultrasounds in the office. We have 2 registered vascular techs who do the test, and then prior to leaving, I review the test with the patient.
And then how soon after, generally, if there were in fact a problem or that they in fact had the varicose veins, would you treat them?
It depends. Most of the time we'll do conservative therapy with compression stockings and elevation as per the requirements of most insurance companies. And then when they come back, if they still have the problem, which in 9 years they all have still had the problem after that 3-month period, then we can usually get things scheduled within a month.
So about
pending approval of their insurance.
So for about 3 months, you say?
Right.
They wear the compression stockings.
Right. Now, if they've been wearing them prior to seeing me and they still have these problems, then they've already done it and they don't have to wait the additional time period.
And
a little hint.
You heard it here. So then they have the surgery, and as you said, it's a quick procedure.
Right.
Generally painless or minor pain. Minor
pinpricks.
But they're feeling and seeing results very quickly.
Very quickly.
And then resume their normal activities within a day
Play
or so.
golf that day if you want to.
That's great.
Yeah.
That's great. All right. We're going to take one last break, and we'll be right back to wrap things up right after this.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
From News Channel 5, I'm meteorologist Henry Rothenberg with your Storm 5 weather update. Still some showers out there, but they're continuing to diminish in coverage as a cold front will slowly push through eventually as we head into the overnight hours. Otherwise, can't rule out a few light showers, but that should continue to taper off. Here's a look at the temperatures. The rain has kept the numbers on the cooler side, but it's been noticeably humid out there. Ample moisture in the atmosphere. Out at Nashville International, these are the current conditions that we're seeing. The forecast for tonight, we will fall to about 63 as our sky slowly, and I mean slowly, begins to clear. A little bit of fog could develop out there. As that burns off on Tuesday, we start with a mostly cloudy sky. Look for that sky, though, to turn sunny by the end of the day. 82 will be our high, 58 overnight Tuesday, and then below average at 78 and mostly sunny come Wednesday, warming next weekend.
This week on Fishin' Affliction TV.
Loopy-doo. Oh my gosh!
Join Dan the Man and Miss Vic down in the beautiful Florida Keys for Volume 1 of Fish and Fun.
You know what we're going to call this? What? Rockin' and Rollin' for Mahi. Yes. You did great.
Your Fish and Affliction TV weekend begins Saturdays right here on News Channel 5 Plus, your home for
Fishin' Affliction time for those who've got it bad.
The Bill Cosby trial. Next, Inside Edition. Cosby's trial for sexual assault. But where was his wife Camille when he came to court? And will his TV wife show up to support him? Then, the amazing real story behind the new movie about a war dog.
Found something!
And the woman warrior he served. Watch the next Inside Edition.
Tomorrow at 4:30 on News Channel 5.
We are so glad you joined us for Medical Mondays talking about varicose veins. We have covered so much. I have learned so much. I hope you have learned so much. If you have a question about your veins, if you're unsure, you're offering an opportunity for people to kind of get it checked out. Tell us about that.
Right. Well, for a lot of patients, they don't know what's going on with their legs. They just know they hurt or they have a problem. And in this situation, we do offer free screenings where either my physician assistant or myself will see you for a free consultation, maybe 5 minutes, look at your legs, talk about what's going on, and give you some guidance.
And to call for that appointment, the number is
615-884-7600.
615-884-7600. Dr. Siragusa, thank you so much for joining us.
You're so welcome.
And thank you for joining us.